This Good to Go segment is sponsored by Corewell Health.
With cold and flu season in full swing, the emergency department at Helen DeVos Children's Hospital has been very busy to provide excellent care to the smallest of patients. The emergency department has processes in place to run like a well-oiled machine any time of the year. Here to give us an insider's perspective is Dr. Erica Michiels. She is medical director of Helen DeVos Children's Hospital Emergency Department, and it is good to have you here, Dr. Michiels.
It's nice to be here. Thanks for having me.
I know, I remember the days of having young children and having to go in to the emergency room for one thing or another. It's a scary time. How do you manage to see all the patients and meet their needs in the order they should be met? Because it can get chaotic.
I'm sure it feels chaotic to our visitors, but we actually have a really well-defined process for how we do this. And it's fairly novel in our emergency department. We have essentially split into two areas where we have an area that's always staffed to see our sickest and most complicated patients immediately upon arrival. And then we have an area that is staffed for our patients who have more simple needs. This helps us always make sure that kids who need interventions right away can get them. But it also prevents kids who have something simple like strep throat from sitting in our waiting room for, hours on end.
It is different, I imagine, taking care of the needs of children as opposed to working in the regular ER, as they say. Is it indeed a special calling to work in that area?
I think anybody who chooses to work with kids does it for a reason. And we do have a special team who works at the Children's Hospital Emergency Department. We have a very tight provider group. So we specifically choose people who have special training and special interest in working with kids. And that really helps us provide a reliable experience for our families. And it also helps our nursing staff know how to anticipate what we're probably going to ask them to do, because we all practice pretty similarly. And we can't do it without our support staff. So we have specially trained nurses, respiratory therapists, child life specialists, techs, who are all there because they love working with kids and they've been specially trained to do it well.
It's cold and flu season. I heard about the RSV kind of surge that has happened. Let's talk about wait times. What can families expect when they walk through those doors?
Sure. So wait times really matter to us. And I'm proud to say that we have some of the shortest wait times of any emergency department in the country. So this is something that we think about and we work really hard on. During normal business, when we're not in the middle of a surge, our, we call it a door to dock time, is about 11 minutes. And even during the most recent surge, we only rose to about 35 minutes. So we're really proud of that. I think it's shorter than most people would expect. Now, of course, it's variable depending on the day you come and the time of day. It may be longer, it may be shorter, but I really want people to know that it's something that we think about and work hard to keep those wait times short.
So talk about the surges then. How do you handle those?
So we have a variable staffing model that we utilize at the Children's Hospital with our providers specifically, so that within a short period of time, just a week or two, we can increase the number of providers who are in the department at any given time. This requires a lot of flexibility and a lot of dedication from that provider group who covers the Children's Hospital. And I think it goes to show just how much we care to meet the needs of our community as quickly as we possibly can. It's a fairly unique scheduling method that we use and something that you won't find in many places across the country, because it does require providers to change their home life really rapidly.
Well, Dr. Michiels, thank you for the work you do. You come into our lives at the scariest of times and give us peace and healing. And thanks too for spending some time with us today. Appreciate it.
Yeah, thanks for having me.